Hello everyone and welcome for today's session. If you are preparing for the MRCGP International South Asia OSCE, then this is the right video for you. In the next few minutes I will explain the exam format, the examiner, what examiners expect, the most important areas to focus on, and most common mistakes candidates do, and also practical preparation which will help you, guide you to be confident in the exam. So let us get started. The OSCE is objective structured clinical examination which is designed to assess whether you can practice as a safe, competent, patient-centered family physician. It's not simply a test of medical knowledge. Instead, it evaluates how you apply your knowledge in real clinical scenarios. During this exam, you will rotate through a series of timed stations, which is total 14 stations. Each station presents a different clinical situation, and you are expected to demonstrate a structured consultation, effective communication, sound clinical reasoning, and appropriate management. Every minute counts, so managing your time is very essential. What are the examiners looking for? Many candidates think that they need to impress the examiner with rare diagnosis or advanced specialist knowledge. In reality, examiners are looking for safe general practitioners. They want to see that you can build a rapport with the patient. So these are the few things they are looking for. Take a focused and relevant history. History should be focused because you have a limited time. Give 3 to 4 minutes to take history. Recognize important red flags. Reach a sensible working diagnosis or differential diagnosis. Explain your management plan clearly. Shows empathy and professionalism. Involve the patient in decision making. Whatever you have decided, whatever you have planned, discuss with the patient. Give the options to the patient. Give appropriate follow-up advice and safety netting. These are things, if you are consistently demonstrate these skills, you are much more likely to score well. A simple consultation structure, here I will share with you using the same consultation framework in every station help you stay organized and avoid missing important points. Start by greeting the patient, introducing yourself, patient's identity, make it confirm, and during the history, try to ask with the name of the patient. Then begin with an open question such as, how can I help you today, Mr. or Mrs.? Allow the patient to explain their concerns before moving into a focused history. Explore the patient's ideas, concern, and expectations. So eyes should not forget, should not miss. This is an important part of patient-centered care and is often overlooked. If examination findings are provided, interpret them appropriately. Explain your likely diagnosis and differential diagnosis in a language that patient can understand. That will be English, but try to avoid from the medical jargons. Discuss your management plan, including treatment, investigation if needed, lifestyle advice, and follow-up. Finally, provide clear safety netting. Explain when the patient should seek urgent medical attention or return for review. So safety netting, once you finish your consultation, at the end you can do the safety netting. Before ending the consultation, summarize the discussion and check whether the patient has any questions. and in last seconds you can ask from the patient that if any questions are there. This structured approach works well for almost every OSCE station. So now, what topics which are highly suggested while any clinical topic can appear? Some areas are tested frequently, like few topics which you have to go through that anyway, which are diabetes mellitus, hypertension, asthma and COPD, chest pain like myocardial infarction or pleuritic chest pain. These some cases will be emergency scenarios. Abdominal pain, severe abdominal pain could be like pancreatitis, appendicitis, and headache, thyroid disorders, anemia, mental health conditions such as depression, anxiety. In these psychiatric conditions, you will have a means good time, because these are the counseling sessions. And women's health, including contraception, abnormal uterine bleeding, PCOS. In this station also examination would not be required. And also child health and immunization cases can be there, which are the proxy cases. Elderly care also can be a proxy case. Preventive medicine, medical ethics and confidentiality. Breaking bad news also can be there. Counseling for smoking cessation and lifestyle modification. So these are the topics which you have to go through them, practice with your partner or any of your friends. Make sure you are comfortable managing these conditions according to the current primary care guidelines. Communication is just as important as knowledge. Excellent communication is one of the biggest factors in passing the OSCE exam. Remember to maintain eye contact and listen without interrupting. Try to listen. Don't keep the checklist. Don't follow the checklist. Use simple non-technical language and shows empathy. Acknowledge the patient's feelings. Involve patient in decisions. Whatever things you have planned, you can involve that patient for that decision which you are taking. Avoid rushing through the consultations. A patient who feels listened to is far more likely to trust your management plan, and this is the exactly what examiners want to observe. What common mistakes candidates they do? Let us look at some common reasons candidate lose their marks. One of the biggest mistake is jumping to a diagnosis without taking an adequate history. So you have a 4 minutes enough time to complete your focus history and then think what could be the key reason of this symptoms which patient has given. Another common error is failing to identify red flags. Don't miss red flags. Some candidates use too much medical jargon, making it difficult for patient to understand. Others forget to ask about the patient's concern or expectation. So eyes is very important. Poor time management is also another issue. Spending 7 or 8 minutes taking a history leaves a very little time to explain the diagnosis and management. So this is the also mistakes which candidates are doing. Finally, many candidates forget safety netting. Never end a consultation without advising the patient when they should seek further medical care. How should you prepare? My recommendation is to prepare in a structured way. So start by revising common primary care conditions. Then practice OSCE stations every day with a study partner. You must have one partner with you, so you can daily 1 or 2 cases can discuss. Time every station strictly. 10 minutes mean 10 minutes. You have to finish during practice in 10 minutes. Record yourself if possible and review your communication style, body language, consultation structure. After each practice station, ask yourself, did I build a rapport? Did I identify the key clinical problems? So whatever the mistakes you have done, did I recognize any red flags? Did I miss ideas, concern, expectation? Did I explain management clearly? Did I provide safety netting? So all these the things which examiner is looking for, you have to revise that. Learning from each practice session is more valuable than simply completing many cases. Final advice: as exam day approaches, focus on refining your consultation skills rather than trying to memorize rare conditions. Think like a family physician, because here you need to show yourself as a general practitioner, safe GP, be systematic, be patient centered, communicate clearly. These are the things examiner is looking for. Demonstrate empathy, and most importantly, remember that the examiner is looking for a safe doctor who can provide effective primary care. If you can consistently demonstrate good communication, sound clinical reasoning, appropriate management, and patient safety, you will give yourself an excellent chance of success. So these are the things you have to follow. Definitely you will go through this exam in a very easier way. Thank you for watching. I wish you all the very best for your MRCGP South Asia OSCE examination. Stay focused, practice regularly, and believe in your preparation. Good luck, and I'll see you in the next session. Thank you very much.